Good afternoon, everyone. This is Dr. Preeti Tyagi. I'm a consultant at Motherhood Hospital. I'm a physician and a wellness expert, and I've been practicing here since past 2 years with motherhood. So I'm happy and glad that I've given this opportunity that I should be sharing some of my inputs on lifestyle diseases. So, seeing today's scenario, we'll be talking about lifestyle diseases and what is the actual reason and why we are supposed to be aware about lifestyle diseases is the whole thing we are going to talk about today. So, I hope and I wish that I could develop some sensitization about this lifestyle diseases to all of you. If you have any queries, you can put it in between and I'll try to resolve as much as possible from my end. So let's get started. So we are Motherhood. We specialize in mothers and child healthcare. And okay, fine. So our specialties includes obstetric, gynecology, pediatrics, neonatology, fertility, fetal medicine, intensive care. So it's a total specialty in under one roof, and we have all the specialists around. So one can seek help if at all. I mean, you are in need of these specialties. So now coming to lifestyle diseases, the topic is what's to blame and who are to blame and why it is important to understand the reasons behind lifestyle diseases. The name itself speaks so much about the disease, so let's understand it thoroughly. So the health realities today. So it's very clear picture which we see today. Today we are seeing a very big pandemic and we are facing with COVID-19 situation. It's been long and it's been annoying as well. So, but then the real fact is that we have to bear with this and we have to face the situation like a total fighter and come out of it. So, COVID-19 itself is a very good example of communicable diseases, the disease which can be spread from one person to another. So that is why we are using masks, we are sanitizing our hands repeatedly because we know that this can be transferred from us to others. In the same manner, when we talk about communicable diseases and we understand so much about communicable diseases, which comes like COVID-19, your colds, and other infections, even through other like you get dengue, you get malaria. So these are communicable because they're communicated with other factors or other this one. But talking about non-communicable diseases, a very good example when we are facing this pandemic, I know we are at home, we are all the time at home, we are doing a work from home, we are working from home, our physical activities have decreased, and this has resulted in the rise of lifestyle diseases to an extent that people are facing so many health issues apart from COVID-19 itself. So, what is the reality today? We are having cardiovascular diseases around. So, what are the lifestyle diseases which we commonly see are cardiovascular diseases, your cancers, strokes, respiratory diseases, diabetes. Diabetes is going to be number one, which will be counted in future as one of the upcoming lifestyle diseases, which will be prevalently seen in many individuals. So, what is an alarming problem? We stand second largest country with childhood obesity. We are the largest diabetic population of the world, and we are the largest young population below age of 40 dying with heart diseases. So, what are the reasons behind? And the major culprit behind the scenario is poor metabolism, poor nutrition literacy, and abundance of high carbohydrate diet. So this is an alarming situation and we need to really understand it properly. So the deaths in India have raised because of this NCD, which we call as non-communicable diseases. So number one comes for heart diseases, second diabetes, strokes, and they are just relevantly related. I mean, they are just one after the another, but then these are the prevalent diseases which we are seeing nowadays. So, what are the five most common lifestyle diseases? The five most common lifestyle diseases are type 2 diabetes, hypertension, heart diseases, disease related to smoking, alcohol, and drug abuse, and obesity. Obesity, we never counted it as a disease before. We thought just it's something which we just see with our naked eyes. But obesity itself is a cluster of diseases. You get to see so many diseases when your BMI ranges from normal to the higher levels. So WHO has itself declared the list of most common lifestyle diseases, and especially in India, which we see are cardiovascular diseases, diabetes mellitus, COPD, that is chronic obstructive pulmonary diseases, that is related with your lungs, and cancers, and then comes asthma, disease of the digestive system, genitourinary conditions, that is related to your kidney and other urinary tract infections, neuropsychiatric disorders, which also is very, very much commonly seen in today's scenario. That's depression, anxiety, and stress, which are bound to happen, which are really bound to happen because of the current situation. We just need to understand, are we facing it or are we becoming the victim of it unknowingly? Sitting disease. This is a new disease, and we have named it as sitting disease because of sitting almost throughout the day, almost 11 hours in a day. A person is sitting because of their working pattern, because of being at home, because of the reduced physical activity, because of this lockdown situation. So, a number of factors have given rise to this sitting situation. Constipation. If you talk about this is a very, very common and very, very unspoken problem which people are facing and which I've been seeing, I think, in the past 2 years, started from the first COVID situation which we were dealing with. Later on, I had started getting patients who had all these complaints piling up together. So constipation is one of the major complaints which we had been seeing in this time, and it is one of the modern lifestyle disease which we can see today in today's scenario. So it can really hamper your many functions of the body, as you can really see on the slides. So, how healthy you are? So, this is the question. Why I've come today is just to make you aware that you should really understand that are you really healthy? So, if you're feeling really healthy, everything is tasty, you are hydrated, you are healthy, you can face all kinds of diseases. I mean, whatever comes to your way, let it be anything, you can fight it very easily. You are at ease, you do not have pain, you have lots of energy, you feel like working, you feel like doing all the physical activities, you like to enjoy. I mean, it's like life is totally different. And when you are not having all these things, then you see the other way around. Sometimes we just fail to see in our day-to-day life, like actually, are we on the healthier balance? I mean, when you see a balance, there are two sides of the balance. We never measure ourselves that how much healthy we are we facing any kind of problem. We just kind of take it as it is a normal part which is just coming up to you, like putting on a little bit of weight is okay, having little bit of breathlessness is okay, having like you're not having your energy levels proper, so you feel maybe this is the reason. So you never try to really find out that is there a particular reason, or is there something wrong with me, that why I'm not feeling fresh or I'm not feeling healthy. So this is a big question, and it has to be asked to oneself. We see commonly 1 in 4 women are dissatisfied with their overall wellness. When I see patients in motherhood, see normally they all come for for pregnancy, for other female related issues, but at the same time when we actually speak to them, it's understood that they really do not feel well normally as well. So, what is wellness? It's first to be understood, and then it should be also understood that we should differentiate between that am I okay, am I not okay. So, that has to be really understood. Next is, so the top health concerns for females are chronic pains, It can be any pain, menopause stage, it's really difficult, your menstrual health, your breast cancers, weight issues, and arthritis. So these are the major health issues which we commonly see in females, and which I think most of the females ignore till it becomes a real problem. So, are we aware of this? That an overweight kid can become an overweight adult. So, in the similar manner, whatever has been there in the beginning can always come to you later on as well. So, what are the symptoms? So, we are going to discuss a little bit about metabolic syndrome, which is related to lifestyle diseases, because lifestyle diseases, when when we continue to have a different lifestyle which is not healthy, we are having some habits which are not good. We are having some kinds of we are having a sedentary lifestyle. We are having physical inactivity. We develop these kind of lifestyle diseases, and when these lifestyle diseases become a disease, they come into a picture called metabolic syndrome at times. So, what commonly we see in metabolic syndrome? Sometimes you see a brownish fold near your neck. Your cholesterol levels are high. You have high blood pressure. You have your high sugars. I mean, your sugar levels are seen higher. You have fatty liver, which is mostly seen, and there is non-alcoholic fatty liver. That means it's not due to alcohol. See, that is a name given to it. So that becomes one of the major reason for you to understand that is there where I'm standing. I mean, am I coming in that metabolic syndrome part? And polycystic ovarian disease, one of the most common thing which we are seeing. I think we are seeing it in every second female we consult or we see as a patient. So they come with this major problem, that is PCOD. So this can also come in metabolic syndrome. So how do you diagnose it? It's very simple. Sometimes it is not necessary to understand things because it is very much visible to you as well. When you see your abdominal obesity, I mean your waist circumference, let's not talk medically, let's talk commonly. Waist circumference can be easily measured and can be easily seen when you see your tummy is popping out up, beyond your body area. So that means something is really wrong and you really need to act upon that. Your cholesterol levels are high. If not, you have not checked your blood. You sometimes it happens that you just do a little activity, you feel breathless, and this is one of the biggest sign you can see that your cholesterol on the higher side. You're having high BP. So this is one of the sign which we need to understand, that are you coming in that metabolic syndrome criteria, and your sugar levels are on the higher side. So if any of these three out of five, if you have any of these three criterias coming into picture for you, then at least you should be the first one to seek help. So, what are the risk factors? So, the risk factors are gender, age, hereditary, ethnicity, which we cannot control. These are uncontrollable risk factors. They come with us because of when we age, our metabolism decreases, other factors, our fighting capacity decreases. So, this we cannot deny. This is going to happen. Gender, female and male version, that we cannot deny, because being a female, we become mothers, we put on lots of weight. So these are things which are a part of the risk factors, but they cannot be controlled. So they come under uncontrolled. And then other way around, you have controllable risk factors. Like you can control on your diet, you can control on your physical activity, you can control on your unhealthy habits. So as I just spoke, age, gender, ethnicity, hereditary. So it's like the body has a harder time protecting itself as it ages. So these are normal sequences. These are normal things which are bound to happen with one person. So this cannot be avoided. But at the same time, like other risk factors like heart diseases, what are the risk factors for that? It's like smoking, high raised BP, elevated cholesterol, diabetes, obesity, physical inactivity. So these are common things which are risk factors for all the lifestyle or metabolic diseases. So these are under our control, and we can very well take it into our hands when we understand things are going out of the way. So it's a time to take action. Like road traffic accidents. What is the risk factors? Alcohol, no use of seat belt, speed, road. We know that this is the reason. So for the same thing like heart diseases, for your cancers, for your diabetes, for your cirrhosis, there are risk factors which can be really controlled. And why not do it? When you have an option to do it, then why not do it? And be a healthier person rather than ending up into having this kind of big health issues which become lethal in the later run. So, is this the answer? Is this the really answer that, having said, I have developed diabetes, I have developed high blood pressure. Of course, we have pills, we have medications, we are thankful that we have this kind of aid. We are so much advanced today that we can take these pills and we can be, we can have our normal levels maintained. But at the same time, this is not the answer for the real problem. You really need to take into consideration that these are just a help to you, a help to your body. So, if you really want to get rid of those problems, you really need to act upon those. So, what are the actions which we really need to take? You need to understand those because these are different for each and every individuals. So, what is important? We really need to understand, are you actually optimal? You are having optimal nutrition. Is your body having proper nutrition? Is your body having a proper function like a normal body should have? Or it is malnourished or it is overnourished. So, both are not good for us, both are the extreme stages. When you are malnourished, again, your immunity is suppressed, and when you're overnourished, that time also your immunity is also compromised. The activation is susceptible to inflammatory diseases. So we cannot talk so much about inflammation because that's a huge topic to be discussed. But my message to you is that we really need to understand, are we having the right nutrition? Are we having the proper nutrition status of our body so that our whole body is functioning properly? So, easiest way for anybody sitting at home, which can be done and which can be first rule out for yourself before you visit us. This is what you can do at home. Count on your health. First thing, we have moved from where to where. The medical field has moved from a start to a place where we can check everything, where we can analyze everything, where we can get a correct diagnosis after investigations. So do not run away from investigations. If you are about 35 today, I say about 35, please go for a regular investigation, blood checkups, because they will give you a good picture of your body status, your nutritional values, and everything in detail. And that is where you really understand, like, am I having a normal body or am I having a normal nutritional status? So everything can have a clear picture. Your BP can be measured. You can measure your sugar levels. When you are a diabetic, you need to have a regular checkup of your sugar levels. You need to have a weighing machine at home to keep a track on your weight. So these are very very simple things and very very important, like BMI. Though it's a best formula which we say, which we use. It's not for normal people, for normal individuals, those who are not bodybuilders or somebody like that. So it's a best formula to calculate your BMI and understand where you belong to. Are you in the normal stage? Are you obese? Are you overweight? Or are you running out? You're getting morbidly obese. I mean, that is the level where obesity becomes injurious to you. Say in a layman's word, it becomes dreadful for you. So it's simple, like BMI is equal to weight by height square. So you take your weight and it's measured by your height in meters squares. When you get the answer as is shown in the slide, so if it is like in the limit, it's healthy. If it is not in the limit, you really need to take care of it. Same, this measuring tape is the best instrument where you can use this for measuring your circumference, waist circumference, and please keep on checking your waist circumference at times when you feel it is needed to be done. So at Motherhood, we have started a new approach towards prevention of diseases. And the wellness clinic has started, and where we take patients personalized approach where we see each and every patients with a detailed discussion with the patients regarding their health, their nutritional status, their weight, any other factors which is which is coming into picture when they are having health issues. So when a person is taken at a personal level, the investigations are done, the assessments are done properly, then they can be guided properly how to track themselves, how to take themselves towards those lifestyle changes, towards those changes which can make them free from all these upcoming diseases if they are doing it at the right time. So when you see things happening which is not normal with you, please seek help. It's nothing but it's an assessment for you. If you see that in that assessment you really need help, it is good to do it early. If you get late, then things might get difficult, and it might be it might come up to the level that you really need to you will have to face the consequences with those diseases which are actually lethal to you. So what is the new thing which is coming into picture after we have seen this pandemic situation? Immunity is the new emerging truth, and I totally believe in that. So once you feel your body is needing help, you because sometimes you can see it yourself. It is very much visible. You get a little, I mean, some the weather has changed a little, and you get a little viral infections very soon. You are very vulnerable. You feel weak. You get sick very often. So that is something when you need to you need to get alarmed. You need to get I mean you need to get ready that, oh, now it's a time that I should check with myself. Am I having something? I mean, am I having something wrong with my body, that why my immunity is not working fine, why I'm not having that good immunity? Because this is the only thing which will help you in the long run in situations like we are facing it today. So what can you do? This is just a tip, like kind of a slide for you all. So please have a good sleep. I'll tell you, 15 days vacation will not equal to you if you have a good one night sleep. An 8 hour of good sound sleep will give you the same effect like you can have in a 5 to 10 days of vacation, which you go and spend outside traveling and just going to places. Hydrate yourself well, eat good food, wash hands regularly, which has been repeatedly telling, so I don't come to this point. And please exercise whatever you like to. Okay, so here I end up with my presentation, but I'll be happy if I can answer your queries if you have any. So we have this wellness clinic at motherhood, and if at all you feel that you really need help in some of these diseases mentioned there, if it is your weight issue, if it is your sugar levels uncontrolled, if you have blood pressure issues, if you have cholesterol levels, if you have PCOD issues, then you have a complete pregnancy care. We started from when a person plans to get pregnant. So from that time onwards, if a female thinks that, okay, now it's time for me to get pregnant, I think it is the right time for that female to understand, is my body fit enough to get pregnant? So this is the time where intervention comes, where we aid you, we help you to develop that fitness, to have that proper nutritional status of your body, so that once you conceive, you have a healthy baby and you yourself remain healthy in the longer run, so that tomorrow you should not come up with the post pregnancy consequences. So, a total women wellness, optimal growth and development in children, COVID care in home isolation, improved immune system. So if you have issues with your digestion and metabolism, constipation, hyperacidity, and some recovery plans. So this is a whole picture where you can you can seek help, and this session was just to sensitize and bring in awareness about lifestyle diseases and NCD, which we commonly say as non-communicable diseases, because at the same time, when we are really fearful and we are really taking care of of ourselves, of fighting COVID-19, at the same time we should be understanding that things are creeping in, like slowly they're creeping in, and we are developing some issues which we are unable to figure out at times. So this is the time when these lifestyle diseases come into picture, and I feel, and I would like to advise that if you just kind of intervene in the right moment at the correct situation, then it's very easy to come back and have a healthy life. So stay healthy, stay safe. Thank you.